Yes, absolutely. And it was all the activities that we're doing that were building so much connection. I didn't need the degree to do that. I just
Yes.
needed the willingness to go into that situation. And that service orientation showed me the attitude and approach that I needed to approach the kind of work I wanted to do for a lifetime. No matter what that is,
Yeah.
I just learned that serving and building relationships and coming alongside people to help them affect change in their lives or just be there. It's not always about change. It's just about being there. To be that support that was what was really important, and you can do that with or without a degree, and AmeriCorps is what really taught me how to see that.
Okay, folks, we are back with another AmeriCorps Connections podcast. I'm super excited because we're continuing the series of their recruitment extravaganza, and we are here with another AmeriCorps alum. And so for the next couple of weeks, we're doing a special recruitment series. For those of you that don't know, I'm recording in like June. This episode might come out in July, but this is really an important time where programs are recruiting for AmeriCorps members to serve during the 24-25 service year. And since I'm an AmeriCorps alum and serving as an AmeriCorps member has completely changed my life, I'm trying to support programs across the country to find folks that are available to serve in these projects. So I'm really excited to be accompanied by Kayla Doyle, and we'll get into your experience and what you're recruiting for. But before we get started, I just want to say thank you so much to Dan Medevere for Time or Money Services, who was the very first one. He's an NCCC alum, that's National Civilian Community Corps, and he stepped up and he said, your podcast is really important and I want to support it. And then also earlier this year, thank you so much, Sharon Tewksbury Bloom. I don't even look at my notes anymore. I'm getting so good at your last name. Do Good, Be Good, CEO and beginner of that organization, who provides training for AmeriCorps programs and so many back-end support. Her and her full AmeriCorps alum team are supporting this podcast as of the beginning of 2024. So thank you so much, Sharon, for believing in me, believing in the content, and realizing that this information and this stuff's important. So without further ado, I want to go ahead and just say, Kayla, thank you so much for jumping on this platform. And we want to hear about your service year, but you also have some exciting opportunities for AmeriCorps members who might be looking to do a year's service or a term of service. So how did you find AmeriCorps, and what did your service year look like?
I started serving as an AmeriCorps member back in 2008, and I was first introduced to AmeriCorps by the person at the time who was a program director, and I was at Cherry Health for my master's in social work internship. So I just met this individual and they said, hey, do you want to do AmeriCorps? And I didn't know what I was getting into, but it sounded pretty cool. So I said yes. And after I did my first very short term of service, I asked if I could do another one. And lo and behold, they had some positions available still. And I signed on for another term. And that is kind of the short story of how I got involved and introduced in it. I didn't go seeking it, but it kind of found me. And it's still had an amazing impact on my life.
I always think it's really interesting. It's exciting to hear about members who serve 2 or more terms. So what was it after your service year, your first service year, that you were like, I still have stuff I need to finish up a few things. Like what was that pulled you back into that service year?
I had started my time at Cherry Health with my master's in social work internship, and I went into that just wanting to get the most out of the experience. And internships are great, but I really understood that I was getting the most connection through the times I was with the AmeriCorps team. So because of that connection, and we got to go out and be in the community, and we got great trainings, and I was making friends, and I was really seeing the whole breadth of what service can do. So at the Federally Qualified Health Center, I was seeing the different ways we can care for the underserved in our community. And I really wanted to just dive deeper into that team experience. And I just wasn't done. I knew I needed to really put some more time and effort and intentionality. Because like I said, the first time it kind of found me. So it took
Yeah.
me a minute to come around to, oh, this is actually really cool. My favorite part is AmeriCorps.
Yeah. And I think one of the things that you said there was that during your service year you had the connections. And if there's one thread, or there's so many threads, I think I'm gonna have to write a book or something about like what people get out of AmeriCorps service year. Um, it is that connection, whether it's connections to other AmeriCorps members in your cohort, or with other organizations or agencies that you're partnering with or you're doing work. Like for me, I was in environmental studies in a park, or environmental education, I guess, in a park, but it was one park within a department. And so I started to understand the community partners, and then like the different departments within that county organization. And that's when I was able to, I like to say, put my tentacles in and penetrate the agency. And so after my service year, I was like, yo, like I did this for one of your parks. Like I want to do this for the whole department. I want to be a volunteer coordinator, and I want to do these different projects. And it's that connection and understanding the work. And I think that like after a second year of service, like did you feel like you kind of understood like your work a little bit more, and your impact?
Yes, I absolutely understood that much better after I was able to dedicate more time to AmeriCorps service, because it wasn't just the impact I was getting from the team. That was maybe
Hmm.
what drew me in, but I
Hmm.
realized how much the community was starting to mean to me. So the community of Burton Heights and Grand Rapids, I just loved it. And at the same time, I was providing a service to them, whether that's helping them enroll in Medicaid or getting connected with different healthcare services. They were simultaneously helping me grow too.
Yeah.
So building that community relationship was really fantastic, and it showed me that even though having a master's in social work is great, a lot of what the successful connections come from is being able to be embedded in the community from a service mindset and making the connections that way.
Yeah, 100%. And I think something that I always speak to is that like during an AmeriCorps year, you not only gain you gain experience, and so you have the degree, but you know, going into like social work, or going into teaching, going into anything, right? It's like I can do this, but if you've kind of done some of it before, then it feels like when you're stepping into that opportunity that you're not just going into it like I believe that I can do this. You know that you can do it. Like you've done it. And even if one of the biggest things that I used to coach my AmeriCorps members life after AmeriCorps was to look at the industry that they wanted to get into and understand the language, because like they were volunteer coordinators underneath their position description, but they were also project managers. Like go into your interview and say that you've done program management, project management, volunteer coordination. That's what that is. And I think that that's something that um, doing a year of service can help you identify where I've done these things for sure.
Yes, absolutely. And it was all the activities that we're doing that were building so much connection. I didn't need the degree to do that. I just
Yes.
needed the willingness to go into that situation. And that service orientation showed me the attitude and approach that I needed to approach the kind of work I wanted to do for a lifetime. No matter what that is,
Yeah.
I just learned that serving and building relationships and coming alongside people to help them affect change in their lives or just be there. It's not always about change. It's just about being there to be that support. That was what was really important, and you can do that with or without a degree. And AmeriCorps is what really taught me how to see that.
Yeah.
Get
It's
my
like a
face out of the
catalyst.
textbook.
Exactly. And in AmeriCorps, an AmeriCorps service year is like catalyst to that, where it's like, we're going to put you in a situation where you're going to build this muscle. So, God, we could go on forever and ever about it. So after your service year, did you roll right into your role? And tell me again what the organization is.
Sure. So I was and currently am with Cherry Health, which is a
Cherry
federally
Health. Gotcha.
qualified health center in Michigan. And most of our locations are on the west side, but we have locations rurally and also on the east side. And we provide many different services. So we do primary care, dental, behavioral health, pharmacy, corrections.
Wow.
It's a really broad scope of services that we offer the community, which is cool on the AmeriCorps end because you have people serving in all of those, well, most of those different ways, or and you at least get exposed to what those different careers look like. Yes,
Did you go right after your service year into working for them, or was there something else that you did before that?
I did. So I went right from a year of service into being a program assistant and
Mm.
a therapist. So the place where I did my term of service was a school-based health center that also served the community, and I got to stay there as a therapist for the kids and community members in that area. And that was half of my job. And the other half was being program assistant.
And I always like to say, like, if you're serving an AmeriCorps year, that's like 1,200 or 1,700, which is about a year. It's like a year long interview. So like act right, because
Yes,
afterwards there's a lot of, not always, but a lot of times there's an opportunity to be hired at your site, or if your organization, your site like partners with other nonprofit or community-based organizations, if you keep showing up, they're going to be like, I always like to say, like, AmeriCorps is the only job that once you start, everybody's looking for your next job, right? Like, you can't take a job and be like, so I plan on leaving in a year. In AmeriCorps you can, though. You can be like, all right, my service year's up in 1,700, 1,200, whatever, 900 hours, and I'm gonna need to find something after this. And everybody's like rooting for you, and a lot of the time they're rooting for you to stay in the organization. So, like, show up in your best way during your service year.
exactly. And I tell members that today. It's
Yes.
because I will be the biggest advocate for somebody who shows up and goes all in and tries their hardest. If they're going to apply to a job within Cherry Health, at one of our partners in the community, or someplace I've never heard of, if they have really shown that they're willing to have the right attitude and approach, go all in, I'll be your biggest advocate. And that was what was shown to me too as I was looking for job
Yeah.
opportunities coming out of service. I had a handful of people who were directly involved in my supervision that were just really, really pushing for me to be hired and believed in me because they saw what I could. They saw, I think, more in me than I saw in myself at that time. So
Yes.
they were able to help me build that confidence I needed to actually land the job.
Since we brought up Chrissy Heine, one of the things she said in her interview with me was so fun, because she goes, Teach for America hired me. And I kept thinking, did they make a mistake? And it's like, wait, what? And, a lot of times your program people, they see something in you where they're like, and if you've gone through a service year, that just shows your commitment, especially when you finish. Like, all of you AmeriCorps members, if you're listening to this and you're struggling with your service year, figure out a way to finish your service year. I used to preach to AmeriCorps members who were struggling. I used to say, well, figure out like what you could learn from this situation. Sometimes it's how not to treat people, and that's fine, right? Like, maybe that's the thing that you're going to learn, and then you're a better AmeriCorps, or you're a better manager, supervisor down the road because of that. Hey, I want to let you know about an event Goodwill Northern New England is doing as part of their efforts to build a community of AmeriCorps alums everywhere. On July 18th at 5 p.m. Eastern, Vista alum Maya Williams shares the story of her service, their best writing tips, and the best tips for adjusting to life after service. During their service at Equality Maine, Maya developed programming for LGBTQ plus youth. She then became a published poet and Portland's 7th poet laureate. If you're ready to join a community of AmeriCorps alumni, then don't delay. Register for this free event today by clicking in the show notes. See you then. So you did your service year, everything was awesome. You got hired. And then now what's your role with Cherry Health and what are some of the opportunities that are available for folks?
So I went from that program assistant role. I think 2 years later, I became program director, and I was that
Nice.
for a while. And then I did a couple other jobs within Cherry Health, and then I came back to AmeriCorps. And I heard somebody the other day talk about the
Yes.
AmeriCorps vortex,
The
and it's like
AmeriCorps what?
vortex.
Oh yeah.
So
Yep.
somehow you get to a certain point, and it's like you can't leave it. You just keep getting pulled right back into
Yes.
AmeriCorps. And even in coming back to the role I currently have now as program director, people will make comments like, well, didn't you feel like you already did that? And yeah, it kind of felt like that at the time. Like maybe I've already done this. Maybe it's just going to be like, I don't know, a short second stay. Who knows? But I was open to the opportunity because it was impactful the first time. And still, even after being involved in AmeriCorps for 16 years, it's still showing me new things because that's kind
Yes.
of the way the program works is it
Mhm.
grows and it evolves and it moves with the current of whatever is going on out there because that's what we're here to do is to respond to the nation's most pressing needs. So
Yep.
that's just like necessary. And you're going to change with the tides of the place that you're working for. So if you are open to that opportunity, it will keep presenting more opportunities for growth for you. So currently, I'm program director of Cherry Health AmeriCorps, and I also am director of academic programs. So I deal with all
Wow.
the students who come in and out of Cherry Health. So that's about
Wow.
um, somewhere between 250 to 300 students every year. I would not recommend somebody be program director and try to tack
No.
something else on, but after 16 years, maybe you get
You're like,
you get your way,
yeah.
figure it
The
out.
report, the AmeriCorps reporting gets a little easier.
It does. You're like, oh, I get it. I
What
get
do
it
they need
now.
to know? Once you figured out e-grants and you have to put your report in at least a week ahead of time because it'll probably crash when you're trying to put it in
Mhm.
the day of.
And on that note, I just want to we're talking about AmeriCorps members and recruiting for current positions. But if anybody out there listening is new to their program director role or program assistant role, and they're feeling overwhelmed,
That's really
I
nice.
really think people should just hang in there for a little while because it is super overwhelming at first because there's so many regs. But then all of a sudden you figure it out and you're like, oh, hey,
Yes.
this is actually pretty cool. I get to go out in the community and do service projects and I get
Yeah.
to be paid for that and I get to have a
Yeah.
say over this program. It's
And
really unique.
yeah, and you get to do service projects, you get to connect with people, and you get to empower people and give them opportunities and give them professional development and coaching. Like it is so rewarding. And the amount of tears that are shed over e-grants and grant writing and all of that stuff, I mean, it kind of is like the 12% incline on the treadmill at like 8 running speed where when you're finished you're like, how did I do that, and then everything else, is money after that. It's wonderful. And I agree. And I don't know how you felt, but I was program director in Maryland under the governor's office on service and volunteerism, and there was a group of like 20 programs, and we all knew when our reporting was due and we all knew when certain things came through and we supported each other. And there were many, many tears on, FaceTime where I'm like, I don't see the button, and they're like, just refresh. And I'm like, oh, the button's there, and then the different regulations and all of this stuff. And I love that you said that. This podcast is to get people interested in AmeriCorps, but I like how you threw in there, like, if you're a program director, like we 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 see you. We
Yes,
have a
we do.
community too.
Yes.
Maybe I'll do a spin-off of like support group for program managers.
I mean, we need it sometimes, that's for sure. And that's one thing
Yeah.
I'm really grateful at Michigan is the Michigan Community Service Commission is endlessly supportive
Yeah.
of all of us and really makes our job as easy as it can be. And so many cool people, which is just, it seems to be the rule for AmeriCorps is you just meet really fantastic people when you go to the national conference or other AmeriCorps
Yes.
gatherings. You meet a lot of like-minded, service-minded folk, and that adds value to your job that you might not get elsewhere. I don't know what it's like elsewhere, honestly,
I
but
know. What is it out there in that real world, that other world? So what are you let's look at what you're recruiting for now. What are the opportunities? How do people get involved? What would they be doing? All that good stuff.
so our program starts, our first date to start is August 19th. So we're coming right up on it, and we like to have all of our applications in 4 weeks
Okay.
at the latest before we start, because we have all those fun
We'll
e-grant
fast track
systems.
this podcast.
Right. Like we gotta get you in so we can run all of our e-grant citizenship checks and
Yes.
whatnot. And we don't want to shed tears over that if we can help it. So the positions that we're hiring for at Cherry Health AmeriCorps, it's the name of our program, Cherry Health AmeriCorps. That's how you'll find it in eGrants. And then you can also go to cherryhealth.org/careers. And that's Cherry
Okay.
Health's career page. And then all of our listings will be on there too. We always keep a general position open in case somebody's interested and they want to apply, but they're not quite sure, or maybe we just haven't gotten around to posting our most recent opening. And then we like to really help direct people. They can say, I'm interested in service, I don't know where to serve. And we work with people in our recruitment process to kind of tease out what it is they want to do and what skills they want to build and match them with the right position. So all of our roles are going to be some way, shape, form, public health related, and there are direct service roles. So we really focus on providing service directly to the service recipients. Sometimes that's not always face to face. Sometimes it's on the phone, making a lot of phone calls, which brings me to one of our positions that we're hiring for currently, and that's in our quality and informatics department.
Ooh.
So yes, doesn't that sound exciting?
Sounds very Gen Z-ish.
Yes. So if you have some computer skills, you're okay with Excel spreadsheets, okay being in front of the computer a lot, it's a really great position. It is also a great way to build phone skills. So I know a lot of people don't quite like being on the phone these days, and this is a great role to be in if you want to get over that, because we will train you how to use the phone, how to do customer service over the phone.
Love
and
that.
Ultimately, what the position is helping bridge gaps in healthcare. So in healthcare, people have all sorts of conditions that different bodies say, okay, if you have diabetes, for example, you need to have an annual diabetic eye exam. You need to be seen this often. We want your A1C scores to be below this number. And then we get all sorts of reports from different systems, our own systems, population health management systems, insurance companies. So the member in that role receives the list, and it has hundreds, thousands of people on it that says, all of these individuals are behind on their health care. So this individual, to use a diabetes example, hasn't had a diabetic eye exam in 3 years. So that means they're at risk for losing their eyesight, which we don't want that to happen. We want people to come in for their care. So the member calls the person up and tries to get them in for service. So whatever service it is that they need, we want to get them seen, and that's why we're calling them. So sometimes it's a little bit of health education, because even if you have diabetes, to use the same example again, you might not be aware of the importance of getting a diabetic eye exam. So the member gets to learn that information, reach out to the patients who need to know that information, and then closes that loop by getting them scheduled, finding out what barriers they have. So do they need to get transportation set up? Do they not have insurance currently? What is it that they need to actually make it to the health center? We help to set them up with that too. So that gap in care is then closed. So hopefully somebody's not losing their eyesight for whatever reason because they didn't get care.
So I spent 6 months in constituent services in Governor Hogan here in Maryland, in his office. And prior to that, I had no ideas about the obstacles and barriers and all of the hoops and loops and jumps that people had to make to just get their basic needs met. And like, as much as sometimes it was frustrating and sad, it was also empowering and exciting when I was able to link folks to services within their county or region of the state. But one of the things that it did for me was really educate me on the the barriers and the different like systematic things that people have to work through. And also I will say about advocacy, right? If I am a person who is working two jobs to support my family, and at the end of the day, I have to go through all of the systems and fight for my um, doctor's appointments or whatever, figure out how am I going to get transportation to my doctor's appointment? How am I going to make time for my doctor's appointment? How am I going to advocate while I'm at my doctor's appointment? That takes so much energy. So guess what? I'm not going to go because I have to get up for work at 6 a.m. and I have to do it again and again and again and again. And I have kids that I need to take care of. So to have that like that link, and I can imagine that like that training for that AmeriCorps member also must include empathy and compassion and probably like mediation and how to like de-escalate disescalate, that's probably not the right word, but like how to meet people where they are and to help them understand that like I get it, I know this isn't covered by insurance, but ultimately like you really like to see your grandchildren, right? Yes. So go to your appointment because if you don't in the next 6 months, you may not be able to see them. So I can totally understand the importance. And that's like, I swear, every time that I've done an interview with these recruitment with this recruitment series, I'm like, why would I do that? Can I do this part-time?
Hmm. I always joke that if I ever want to switch jobs and I'm not quite sure what I'm going to do,
Yeah,
I'm going to serve in an environmentally focused program just so I can be outside all the time
yeah,
while I
yeah.
find my way.
Yeah, that sounds like a really cool opportunity internally. And I really like, so this is a pivot from just the positions, but I like what you said about there's a general application or general kind of um inquiry for programs that are out there that are recruiting. I think that's really cool because it can be overwhelming. I work with an organization that has like 30 different Vista projects. And maybe they're like, I don't know, and so cool to like, I want to serve as a Vista member, but I don't, I don't know what I want to do. And then be able to have a so do you do a consultation with somebody and like kind of talk to them?
Yeah, so our program coordinator will call the individual up, and we just call it a phone screen. But really, that's what we're finding out is, okay, you applied for this position. These are the benefits. Are you okay with that? What are you looking for in applying for this position? And sometimes just based on where people are coming from and their skills and what they envision getting out of the role is or is not a match for what they actually applied for, because we just do our best when we read whatever is put on the careers
Yeah.
page.
Yeah.
So we will say what other opportunities might be a better fit. And sometimes we have people interview with multiple site supervisors. So we do the phone screen, then we do our first interview with just program staff to make sure that's a good fit and to describe a couple positions if there are a couple that we're deciding upon for the member and their members deciding on. And then we pass them on to the site supervisor because that site supervisor knows the role better than we do. They
Right.
know the daily ins and outs and the nitty gritty, and they can tell what they really need in a member. And you want that personality to click because the site
Hmm.
supervisor is so pivotal to having a successful term of service.
Yeah. Oh, so what else should we know about your recruitment? I want to make sure everybody's getting all the information that they need.
For recruitment, one of the more important things that we hire for in any position is Spanish speaking capability. So somebody who can
Mm,
speak Spanish and English is just really high demand. At some of our health centers, upwards of 80% of our population speak Spanish. So it just becomes crucial that whoever is providing the service can speak that language. So we are willing to work with people. So they do need to be 18 or older. Some programs I know accept younger, but because we're in a health center, 18 is
yeah.
our minimum age. And if you're out of high school and you're not quite sure what you want to do, but you can speak Spanish and you want to
Hmm.
serve the Spanish speaking community and you're willing to learn as you go, we're probably willing to take a chance on you if you're willing to, put your all into that term of service to learn and to grow and learn what you need to do to fulfill the position. But that
Yeah.
Spanish speaking is really important. And if that individual does any sort of interpretation as part of their role, we do provide interpreter training. And that doesn't happen a lot anymore because we have a
No.
newfangled iPad that does all
Oh,
of our interpretation in just about
nice.
any language we need. But for anybody who does speak Spanish and they're required to use it in an interpreter capacity, we provide an online interpreter training for them. So they can actually get a credential by the time they're done if they choose to sit for the healthcare interpreter exam. We provide that training, and that training is $640 last I checked. So
Wow.
that's a really great benefit and bonus.
I'll
Um,
have to see if I can translate this podcast into Spanish so folks can.
oh,
I don't know. I don't know how to do that. I'll have to figure it out. Like, why not?
yeah, that could be really cool.
Google Translate. Translate this whole podcast. That's I love it. So one of the things that I think is so important with programs and when people are trying to figure out what their term of service might look like are those extra perks. And how amazing is it to be able to provide that certification and that experience, right? Like somebody may be able to come in and be like, yeah, I speak both Spanish and English. I can do all that stuff. But in like literally going through a year where you're doing that interpretation for patients and their outcomes are based off of like making sure that you're giving them the accurate information through the interpretation and then ending your service year with a certification. I think it sets people up for like massive success. um when did that, like, was that always like a bedstone of your project, or was that something that just kind of developed recently?
That has always been something that we've done. So we used to do interpretations as a core service of what we provided on our
Okay.
AmeriCorps team. We do less now just because of technology advances, and it's really hard and even with AmeriCorps, it's super expensive to get enough bodies and people to provide all the interpretation you need. And we have over 72 languages within our patient population. So it just makes a little more sense to go with a tech option that
Yeah,
provides all the languages.
that makes
But we
sense.
started doing the training for interpreter members who interpret um, handful of years ago. So we would do different types of training before. So we've always provided training, but the training now we leveled it up a little bit because it's just becoming more and more important in AmeriCorps that the members who are serving do walk out with some sort of credential.
Yes.
So we wanted to be sure to provide that. And it helps us to be compliant with the standards that we are beholden to in a health center because they're pretty high. You can't just have anybody interpreting for your medical appointment because if you mess it
Right.
up, there are consequences.
Yeah, I feel like there could be consequences. Did you say high blood pressure or low blood pressure?
Yeah.
Like
Or
alto.
like exactly, are we taking one pill or are we taking 11 because they're really similar?
Yeah.
Uh,
Yeah. That's so cool. Um, well, as we kind of land this plane, what are some of the things that you want folks to know about your program and just AmeriCorps National Service in general?
So a couple other logistical things. We do provide community health worker training as part of our program.
Mm.
So that's another credential that people can learn if they serve 900 hours or above. We partner with Everyday Life Consulting, which is a consulting firm in Michigan, and it's hybrid, online, in person format. So we do that to help people get that done. And so they not only learn skills that they need for their service, but they can become community health workers when they're done, which is really kind of a hot job right now and
Yeah.
a great way to learn how to just operate with people in the healthcare system and people in general. So that I think that's one important thing to know because yes, that might draw somebody to the program. Another thing is that we put a lot of time and attention into the member experience.
Mhm.
So the typical schedule of somebody serving 1,700 hours, which is your full-time term over 52 weeks, we do 35 hours per week is considered our full-time spot. So members will typically serve Monday through Thursday, 8 to 5, sometimes a little variation in there. And then on Fridays, there are member days. There are team days.
Love that.
Members don't serve on site. So we do one of three things. On two Fridays from 9 to noon, we will do team meetings. So we get together and we do team building. We do different trainings. So we might learn about adverse childhood experiences or mandated reporter training, or the most recent one we did was called Hope Pathways, which is kind of the antidote to adverse childhood experiences. And it talks about how creating positive experiences for children helps to kind of balance out the bad things that happen and how
Yeah.
that can really
Yep.
create a great life. So we do all types of trainings that our members really like. So when we do our end of the year evaluations, people say team meetings. I love team meetings, coming together with my team, getting to know what they're doing, learning something good. We have a little bit of fun. One of their favorite aspects. And it just
Hmm.
breaks up the monotony of your work week
And
or
and it
service week.
yeah, and it just really builds like basically the whole reason for this podcast, AmeriCorps Connections, right? Like it builds connections. It builds you start to understand like how to connect with people, whether they're similar or different than from you, and they last forever and ever and ever and ever and ever. And everybody's doing something different. Where other than you, 16 years. Hello. We're not in the same field in the same thing, but we can tap in and out of like what folks are doing, and it's so important. I love to hear the cohort aspect of it because I think that's so important.
It is so important. So we definitely keep that team meeting space to be really just core to our
Yeah,
program. And another thing we do on Fridays is service projects. So we go out into the
yeah,
community from 9 to noon, and we're going to Meals on Wheels or Feeding America or Gilda's Club. One of our local programs is called Kids Food Basket. So that was our most recent service project. And from 9 to noon, we planted over 2,000 pepper plants. And that was really fun because we got to be outside and literally get our hands in the dirt.
that's
But
cool.
all of those plants are going to grow fresh food for children who don't have regular meals at home or are at risk for being food insecure.
Hmm.
So, Kids Food Basket, what they do is they put together sack lunches and distribute them to students. And then they get to bring it home for extra nutrition or maybe an extra meal if it's like uncertain if they'll get that. And a lot of members end up using that as a networking avenue for future employment. So maybe they
Yes.
really thought Meals on Wheels was fantastic. So they're going to go there and really put a lot of their attention into that partner so that they can get hired. We had somebody do that with Feeding America last year. Now they work for Feeding America because they just really loved our projects there.
I
So
love that.
that's fantastic. And then the last thing we do on Fridays is on your own independent training because we do have a variety of trainings through Community Health Worker and other platforms that they need to do. They're actually required to do. So it
Yeah.
gives them 3 hours where they can just dedicate time to sitting down, doing that training. And if they finish all of those, we allow members to request training that applies to them. So it applies to them, their
Mm,
personal development, their professional development. They can
that's
shadow,
amazing.
whatever it is. So we try to provide lots of options. And then who doesn't like a half day Friday? So you'll
I
miss
know.
that when you get in outside of the AmeriCorps world.
Yeah. My 9 to 5 on during the summer we have half day Fridays. I can't tell you when I get that email where they're like, "Oh, so starting June 1st, it's half day Friday." I'm all,
Let's go.
"No."
It's
I
perfect.
I literally feel like Simba. Everything that the light touches is yours. I'm like, "Yay!"
Makes a huge difference. Well, not well. The light touched it before, but now, yeah, it can be yours because you've got half a day.
Exactly. No,
Go
and
get
it's
it.
summer, so it's like it doesn't it's 8:15 right now and I got still full sunlight, so I'm working
Hmm.
on some good stuff. Kayla, this has been so wonderful. Cherry Health, what a fun name. Sounds like an amazing organization and amazing opportunity. I'll make sure that I have all of the links in the show notes. Um, but if somebody was like, "What is that? How do I connect?" and they're not going to go back to the show notes, what's the quickest, fastest way to learn more about your opportunity?
The quickest way, honestly, just probably email me. That might be a really good way. If you go
Okay.
and we can put that in the program notes, or I can. Would you like me to say
Yep.
it right now? Okay.
Yeah. Go
My
ahead and say your email.
okay. My email is KaylaDoyle at cherryhealth.com.
Mhm.
And not org.com. Kayla Doyle
.com.
at cherryhealth.com. Cherry as in the fruit, health as in healthcare. We are on Cherry Street. That's where the cherry comes
That's
from.
funny. That's
um,
very good.
and you can also email AmeriCorps at cherryhealth.com, and that's kind of our generic. So as program positions, people come in and out of positions, somebody's sure to get that email.
Always, yeah.
And if you go, you can find us on Facebook. Facebook, we have a Cherry Health AmeriCorps page. LinkedIn, we have Cherry Health AmeriCorps. So if you really want to get some insight into our service projects and the fun things we do, and is the team really fun, or is she just saying this? I think Facebook is actually probably a pretty good way, or Insta. It feeds into Insta
Okay,
as well.
that's awesome. Well, thank you so much for jumping on this opportunity to share your program and thank you for serving and for being at Cherry Hill Health for 16 years. I mean, wow. That's amazing. And so folks that might find this interesting, please reach out to Kayla. And if you're like, well, I'm not in Michigan, what else could I do? Reach out to me and I'll point you in a direction of maybe where I could help you find some service options. So if you've listened this far, thank you so much. Don't forget to like and subscribe because it actually makes difference. And we'll be back for another AmeriCorps service. Well, yeah, we're winding down a recruitment series, but we'll be back with more, I promise. Thank you so much, Kayla, and we'll be back. Take care.